Welcome to the Path You Take podcast, where the path you make is the path you take. Today, I'm here with a special guest. Please introduce yourself.
I'm Wahida, and I'm a nuclear medicine technologist.
What education path did you take to get into nuclear medicine?
Nuclear medicine, you can actually get in right after the high school, as long as you have really good marks. For me, I was not sure what I would like to do, so I first did 2 years of general sciences, and I got my associate degree in 2 years, and then I decided to go into nuclear medicine.
Okay, and which courses were generally most important?
All the sciences like biology, chemistry, physics, as well as math is important, and you need really good marks to get into this program.
That sounds a little bit intense. How competitive would you say it is to get a career in nuclear medicine?
It's hard to get in. It's also hard to graduate. I would say, about 25% of the applicants do get into the program. But a lot of people may change their mind during the program, or for different personal reasons, they may not be able to continue the program.
Okay, what does a typical shift look like for you from start to finish?
There are many different shifts in nuclear medicine. As you know, nuclear medicine is the only test that looks at the function of the organs.
Right.
So, for example, you would inject material that goes to the bone, like you tag it with the radiation, and if it's calcium, it'll probably go to the bones, and then if there is higher activity in certain parts of the body, then it will absorb more of that material. So you look at the function of the bone, at the function of the muscle, at function of the kidneys. It's quite interesting how you do it, but usually in the mornings you do a lot of injections, and in the afternoon you do a lot of scanning.
On that note, how do you ensure that radiation exposure stays safe for both you and your patients?
For patients, it's a very small dose that we inject, so it's typically very safe. For the nuclear medicine technologists, we try to protect ourselves with wearing like very heavy lead aprons.
Right.
We also wear a TLD, which monitors the amount of radiation we get under our vests. So some of the organs are more sensitive to the radiation. That's like more, it's not the arms and the legs, so they can be exposed to radiation. But anything inside the body needs to be protected by the lead aprons. And then every year, they read the TLDs and see how much you have received during the year. And usually it's nowhere near the amounts that's worrisome.
Okay, that's really good. How important is understanding the radiation physics and the equipment you use?
Very important, because the dose you give to your patient has to be within the acceptable limits. And then the dose that you receive also has to be within the acceptable range. So, for example, if someone is expecting and they're pregnant, they're allowed a smaller amount of radiation. And then they usually wear a couple of TLDs in different parts of their body, just to also monitor how much the baby is getting the radiation. So it's safe, and you're monitored very closely.
That's really interesting. For those who are interested in a career in nuclear medicine, what might a starting salary look like?
There's usually the starting wage is about $39 to $41 an hour. You typically work in the hospitals. There are different parts. You can work in the lab where you make the substance and to inject into the body, or you can work with the patients and do the scanning, or you can do the injections. Sometimes you go to the different wards to do the injections in the wards, and then they bring the patient down to be scanned. Sometimes you work closely with a cardiology technologist because you exercise the patient to see how well their heart is doing. So you work in the hospital with all different departments, and it's quite interesting.
Yeah, to you. Okay, on to our final reflection question. What's the most challenging part of your job, and what makes it rewarding?
Um, I guess because you're working in the hospital, your patients can be a bit more challenging in terms of movements. They're not able to transfer themselves, so you would have to use lifts to transfer your patients. And sometimes they can be, on a wheelchair, and then you have to help them transfer. They're usually connected to very different machines, and you have to ensure their safety and make sure you're doing the transfer safely for them. Um, but it's really rewarding because you can help them get better, or you can stage their diseases and then, get, help for the organs that are affected. So you're continually improving the health of people, and that makes it rewarding.
That's such a beautiful answer. Thank you so much for answering these questions, and thank you for being here tonight. I was wondering if you would recommend any courses or anything recommendation for someone interested in this career.
It's very important to have your patient care, your terminology in medicine. So if you can take those kind of courses that help with helping you take care of your patient safely, and the terminology and all that, it will give you a higher chance of getting into the program faster. Volunteering is really important. You can volunteer at the hospitals, and any other volunteering in health care is also recommended.
That makes a lot of sense. Okay, in your experience, would you recommend this career to anyone interested?
I thought it was really, really interesting, but I always wanted to do ultrasound. So for me, the next step after nuclear medicine was to do ultrasound, just because you don't have to worry about the radiation part of it.
Sure. Well, thank you so much for being here tonight and for answering these rapid fire questions.
Of course, my pleasure.
Thank
Happy
you.
to be here.
A SPECT scan is used to assess the function of tissues or organs in your body to identify disease. A CT scan provides your doctor with high-resolution images of structures in your body. In other words, SPECT assesses physiology and a CT assesses anatomy. Today, generally a SPECT CT scan is performed where the images from the two different types of scans are captured during one session using a hybrid scanner, and the images are combined. Each piece of information is important, but when combined, they are even more useful. A SPECT CT scan is undertaken in two parts: the administration of the tracer and then the scan that shows how the tracer behaves in your body. A nuclear medicine is generally administered through an intravenous injection, but can also be inhaled, swallowed, or injected in the skin. What study you have will decide how the tracer is administered and whether it is done lying down on the scanner or elsewhere in a chair. The injected nuclear medicine gets taken up and concentrates in the part of the body under investigation. Some diseases cause increased function, some cause decreased function, and some cause changes in function, all of which can be imaged on the scanner. Virtually all organs and tissues can be investigated using nuclear medicine. The most common procedures include the bone to detect and assess changes in bone function associated with cancer, trauma, and metabolic changes, and many other diseases. The function of the heart can be evaluated by examining blood moving through the heart or imaging the blood flow and movement of the heart muscle itself to diagnose a variety of diseases. Nuclear medicine can also be used to study lung, kidney, thyroid, brain, and many other organs and tissues in the body, and importantly, to investigate cancer. Because some body functions are fast and some are slower, the time between administration of the tracer and the scan can vary from minutes to hours. Some people may even be required to come back on multiple days. For diagnostic scans, the nuclear medicine is radioactive and emits gamma rays that can be detected by the scanner. The SPECT CT machine has two gamma cameras that detect gamma rays and produces a map of how the tracer is behaving. These detectors rotate around the body, taking images every few degrees, allowing images to be reconstructed in 3 dimensions. The SPECT scan can take 10 to 20 minutes, and then the CT scan takes less than a minute. The scan collects important information that is processed by a computer. This information is then carefully reviewed by a specialist nuclear medicine physician to produce a report for your doctor. Your doctor will use the information to help determine how to manage your specific health condition or assess the response to current management.